Welcome to the very first video on AMC Express for AMC or Australian Medical Council Examination Part 1. Today we are solving a classical psychiatry question that connects bipolar disorder with renal physiology. This is exactly the kind of multi-step thinking the AMC examination tests. So let's get started. Pause the video right now. Read the vignette and lock in your answer. Okay, the correct answer is B, hydrochlorothiazide. If you picked that, excellent work. If you did not, don't worry. This is a very common trap. Let's break down exactly why this happened. So, to solve this question, first of all, we will have to nail the diagnosis. Look at the symptoms. Nausea, vomiting. These are very common side effects or very common symptoms. Now, coarse tremor, ataxia, confusion, nystagmus, and hyperreflexia. Pay close attention to the word coarse and coarse tremor. So the coarse tremor is distinct from fine tremor of therapeutic lithium. Coarse tremor is seen in lithium toxicity and fine tremor is seen during the therapeutic doses of lithium. So coarse is for toxicity and fine is for therapeutic. The trigger here is the new antihypertensive medication she was started 2 weeks ago by her GP. We are looking for a drug that messes with kidney's ability to clear lithium. Now, this will be the most high yield part of the video. Why did hydrochlorothiazide cause this toxicity? So for that, you need to remember this rule. Sodium and lithium are bestest of friends. Wherever sodium goes, lithium follows. And the kidney? The kidney literally cannot tell them apart. Thiazide diuretics like hydrochlorothiazide, they act on distal convoluted tubule to block sodium resorption. This makes the body panic because it's losing salt. So hydrochlorothiazide causes hyponatremia. It acts on distal convoluted tubule. Okay, so now what will the body do? The body tries to compensate upstream at the proximal convoluted tubule. And what will the body do? It will try to reabsorb sodium to save it. But as we know, the sodium and lithium, they are bestest of friends and the kidney literally cannot tell them apart. So the lithium gets reabsorbed alongside the sodium and this causes the spike in the lithium levels in the blood. Now this slide I have shown the mechanism of action of lithium, use of lithium and excretion of lithium. So first of all, the mechanism of lithium. It affects neurotransmission. So it increases inhibitory neurotransmission and decreases excitatory neurotransmission. It is used as a mood stabilizer for bipolar disorder and it treats acute maniac episode and prevent relapses of such episodes. Lithium is almost exclusively excreted by the kidneys. Most is reabsorbed at proximal convoluted tubule via sodium channels. Now, The take home point from this slide will be thiazides, ACE inhibitors, and NSAIDs affect the clearance of lithium and are implicated in lithium toxicity. So, thiazides, ACE inhibitors, and NSAIDs, they affect the clearance of lithium and are implicated in lithium toxicity. This is a high yield question. It can be asked in your AMC1 examination as well as USMLE. Now, in this slide, I have written several side effects of lithium toxicity. However, you can remember the side effects of lithium toxicity just by remembering the mnemonic lithium. So, LT in lithium stands for low thyroid or hypothyroidism. But remember that the lithium toxicity can also cause hypothyroidism. H is for heart, specifically Epstein anomaly. I is for insipidus, nephrogenic diabetes insipidus. And in lithium, it stands for unwanted movements or tremor. Now, let's look at other options as well so that you never miss this question again. Option A, amlodipine. Amlodipine is a calcium channel blocker. Unlike diuretics, calcium channel blocker do not significantly alter renal lithium clearance and are rarely the cause of toxicity in exam scenarios like AMC exam or USMLE exam or even NEET exam. Option C, beta blockers. Beta blockers are safe to use alongside lithium. In fact, propranolol, a beta blocker, can be used for tremors associated with therapeutic lithium use. Now, just remember, coarse tremor, that is lithium toxicity, and fine tremor, that is therapeutic lithium, right? Option D, prazosin. Prazosin is an alpha blocker. It is metabolized by the liver. Option E, moxonidine. It's a central alpha 2 agonist. Moxonidine works centrally and does not interfere with renal clearance of lithium. Now, before you go, I want to share you a pro tip. This is exact strategy I use to break down every single MCQ to ensure I do not make silly mistakes. Step 1. This is, by the way, a 4-step approach. We'll start with step 1. What is step 1? The bottom line. What is the bottom line? Always read the very last sentence first. Are they asking for a diagnosis, a management step, or a side effect? Here, they want the medication. So, step 1 will be reading the last line or the bottom line. Which of the following antihypertensive medication was she most likely prescribed 2 weeks ago? Right? Now, step 2. Step 2 is the complaints with which the patient presented to you. So, over here in this question, a 42-year-old woman presents to emergency department with 3-day history of nausea, vomiting, coarse hand tremors. What kind of tremors? Coarse hand tremors. Unsteadiness on her feet, that is ataxia. She appears confused and disoriented to time and place. Right? So, the complaints, they set the context. The complaints adds the context. Now, step 3. Step 3, the history. History can be either past medical history, history can be either past surgical history. They might have given what all operations or what all surgeries she might have had in the past, what all medication she is currently on. So in this vignette, she has a history of bipolar 1 disorder and hypertension. For bipolar 1 disorder, she has been stable on lithium carbonate for past 5 years. And for hypertension, she was started on a new medication by her GP 2 weeks ago. Right? So now the step 3, it connects the complaint to a cause. The complaints was our step 2, and it connects with step 3, a cause. Now step 4, the objective data. Right? What is objective data? Physical examination or a physical finding, an image that is given to you in a question, or a laboratory finding. Over here, in this particular example, it's a physical examination. Alright? She has horizontal nystagmus and hyperreflexia. These are our objective findings. Now for vitals, blood pressure is 130/80, heart rate is 88, and she is afebrile, means no fever. Right? So this was our step 1, this is our step 2, this is our step 3, and this is our step 4. So now combining this 4 step gives you the clear picture. It might feel slow at first, but if you perfect this method, you will stop missing easy questions. You can thank me later. So yes, that's it for today. If you want to master the AMC one question at a time, hit subscribe to AMC Express, hit like to AMC Express. I'll see you in the next video.